after leaving the hospital. During those 4 to 6 weeks after discharge, you will attend physical therapy Monday through Friday. You will also be seen weekly and as needed by lung transplant team members for clinic visits or bronchoscopy visits, or both. A bronchoscopy is an outpatient procedure where you are placed under sedation. You will be asleep enough where you will not remember the procedure, but not sedated to the point where you require a breathing machine. During the procedure, the physicians will insert a flexible tube from your nose into your throat and into your lungs. This tube has a light and camera at the end that guides the physician as they look inside your lungs. The purpose of a bronchoscopy is to clear secretions or collect tissue to evaluate for possible lung rejection. What is lung rejection? Lung rejection is something we routinely look for. We expect to encounter it, and when we do, we treat it. Having rejection certainly does not mean that your lungs will not work properly. It is common, especially in the first few weeks after transplant, to experience a rejection episode. If rejection is found after a bronchoscopy, it can be treated with high doses of an IV steroid medication called Solumedrol. IV Solumedrol can be given outside of the hospital, so you do not have to be hospitalized. This will continue to speed your recovery process by having you come to physical therapy uninterrupted. Again, it is important to remember having an episode of rejection right after transplant does not mean your lung or lungs will be damaged or not function. We are here to identify it and move forward with your treatment. When can I get ready to go home? Generally, you will be allowed to return home about 30 days after you leave the hospital, once you have achieved your physical therapy goals and no longer require weekly follow-up with the lung transplant team. It is expected and required that you continue to receive lifelong care and treatment at Shands. How frequent are my follow-up visits once I am home? You will be seen every 1 to 2 months the first year, about every 3 months the second year, and then spread further after 2 years when things are going well. If you require medical care before your follow-up visit, you should absolutely communicate this to your coordinator so that you can be seen the same day or the next day for care. The Lung Transplant Support Group meets once a week for an hour.
Today I am 5 weeks out from a single right lung transplant.
The support group is facilitated by a social worker and another transplant team member who is typically a nurse coordinator. The purpose of the support group is to provide transplant information both pre and post to the patients and caregivers who are going through the transplant process. At support group, patients and caregivers sign in, introduce themselves, and share their personal experiences with lung disease, where they live, and why they are there. People who are coming in for the first time have an opportunity to see others who have already gone through the process. Each support group session begins with an instructional lesson exploring topics like dealing with anxiety, specifics about immunosuppression medication, caregiver stress, waiting on the wait list, and common issues with transplant such as rejection and infection. Information that is shared within group is confidential and respect is given to everyone's privacy and opinions. Everyone's experience is important and individual to them and may not accurately reflect everyone else's in the room. Quality of life after transplant. A lung transplant will give you back your life. We do have recommendations to keep you healthy in your new life, such as avoiding situations that will expose you to infection. Some patients want to know if they can return to work after transplant. The general answer is yes, with a few considerations given to the type of job you had prior to transplant. If you are a plumber or carpenter, no. A preschool teacher, no. High school teachers, pharmacists, bankers, sure. Some of our patients have gone on to participate in various athletic events in the transplant games. Thank you for watching this patient education video on our lung transplant services. We hope you found this information informative, and we look forward to serving you.